Hey, good afternoon, everyone. This is Dr. Ray from Bradford Family Chiropractic. We're here with intern Michael. We're going to be going over a quick demonstration on what you can do for Achilles tendonitis. Today's video, we're going to talk about how to treat Achilles tendonitis with kinesiology tape. The taping in and of itself is not the best treatment option we have for Achilles tendonitis. We might want to do things like simple passive and active stretches, maybe some eccentric calf raises that we'll talk about in later videos. However, first of all, let's talk about what Achilles tendonitis is. So if we're looking at our model here, pain right down at the insertion of the Achilles, right at the bottom of the calf as it inserts to the calcaneus. Pain here, especially worse in the morning or with forceful push-offs of the foot, we're going to consider it a likely diagnosis of Achilles tendonitis. So back to what we have here, how we're going to treat it. I got one of these pre-cut kinesiology tapes. This is the KT tape, rock tape, plenty of other varieties. What I did in this case is I split it right down the middle with about 1.5 inches left. And how we're going to apply it is we're going to simply peel off that little tab of tape. We're going to insert it right down at the calcaneus, and we use the back side of the tape, where the KT is here, to rub it in gently, activate the adhesives with the heat, and then what we're going to do is we're going to, with the pre-cut tape, we're going to track this up and along the pathway of the gastroc. And this one we're going to do just as well. So this would be a quick, simple taping job for an Achilles tendonitis. Now in his case, if it's a more aggressive case, we might want to put what we call an anti-inflammatory strip. So in this case, we have another piece of tape, and typically this is the area where we have inflammation. So in this case, we might put a little stretch of tape on here, where we're going to put a little more stretch on this tape versus the way we did it here. So in this case, we're going to stretch it to 100%, drop it back to about 50%, lay it right over the area where the inflammation is, and now we're going to lay down the tape. And notice, it's very important not to stretch out the end tabs of the tape, and I'll show you better on this side. We don't want to stretch out this end tab. It doesn't allow for it to adhere or stick very well if we stretch it. So in this case, we're just going to lay it down flat. And we're going to roll it along, and we're going to use the back of the tape to activate the adhesives. Okay, so this is how we're going to do some kinesiology tape for Achilles tendonitis.